Live from Northern Virginia, this is Dr. Garais, your host for BIO117 Week in Review. Now, tomorrow, the 17th, tomorrow the 17th at promptly 8 a.m. in room 123 will be Unit 1, Exam 1, which will cover chapters 14, Blood, chapters 15, Cardiovascular, and chapters 16, and which is our lymphatic, which is pretty much like immunology 101. So the thing to really focus on is the quiz questions, because they were must-know topics, and there were, of course, 20 items, so there are 20 must-know topics. But we're going to go over the mystery just one more time, even though we did it yesterday. We're going to go over the mystery of what is on for chapter 16, which is pretty much the lymphatic system / immune. So I'm going to go over some samples. I'm going to try to make it not like the exam, which is really hard. So the first high-valued thing, and remember, the immune system wasn't so full. So if you're gonna, the majority of the questions, there's like 20 of them out of the 15, is 20 or 22 of them, somewhere around there, or 25, will be on chapter 15, the cardiovascular, because you see the cardiovascular's got a lot of what? It's got just a lot of topics, a lot of things we can ask. And chapter 14, of course, is going to have some overlap with chapter 15. I think I made around 13 or 14 questions. And then the remaining would be, I think I made 10 or 11 questions, and that's what we're going to redo yet once again, just so everybody's on the same page, chapter 16. So right off the bat, which was one good high-value target is, first of all, what is the actual function of the lymphatic system? So would the people go here, and we are in, where are we, 119? If you want to come join us, but we're on Teams, and I put the link on announcements. So if we know, it goes like 3 functions, but really you can boil it down to 2. So if there's only 2 functions, the first one is, of course, it's prevention of edema. I think I could ask, what is edema? So what is edema? Is that a good thing or a bad thing? It's a bad thing. Fluid. It's the fluid or interstitial fluid, what they call third space fluid, like all the extra outside of the cell fluid or extracellular fluid is too much, right? And if it's too much, right, typically the lymphatic system will empty it out. So it's prevention of edema. So that's why all lymphatic tissue mirrors, or it's along with all other artery and vein gets like bloated with extra fluid or extra plasma. What typically will our lymphatic system do? Now, I'm finding myself re-lecturing. Let's not do that. So we know, but prevention of edema, let's say we know our textbook, right? We know we're not looking at our textbook anymore. We're probably not even looking at the PowerPoints at this point. We'll boil it down to what kind of question. So one kind of question that I like is, of course, is a physiology, function of lymphatic system. And the 2 that we really talked about was prevention of edema and, of course, the immune function. Because the lymph fluid has what? Blood cells. So don't you think that looks like a beautiful both A and B question? Yep. So it goes, or I could ask you, what's edema? Or I could ask you, what's inside actual lymph fluid? What makes it so special? Right? Eating Doritos? Miss Fallon, kindly mute. It goes, I could, no, it sounds like turning pages. That's what it sounds like. I'm just thinking Doritos because that's what's in my mind right now. Now, what's another? I'm looking at my actual exam, and another thing was, of course, we have a layers question, right? So our lymphatic vessels, just like our arteries, veins, they've got layers. And what's so important about the layers? Well, let's ask the layers of the lymph vessel. We know they have, the layers are always what? The outer one is always a tough one, right? Yeah. So the outer will always be the tough connective tissue. Will always be what? Smooth muscle. Now, can we control this muscle? No. Nope. And of course, it has some elastic fibers because what's the hoses? We know that it take a bunch of fluid, so it's got to be able to expand. You know, like you see one of those hoses that you get like at CVS, because and that's what the lymph vessel does. And of course, if it's inside, it's what? Endothelial lining. Endo means what? Inside. So I'm doing it backwards. Inner, so endothelial. So right now, just by putting this high value topic, it's creating it's your own question, isn't it? So what question can come out? Which of the following is the outer, which of the following is the outer layer of your lymphatic vessel? And you're going to tell me connective tissue. Which of the following contains smooth muscle and elastic fibers? Middle. Which of the following contains the endothelial cells or the inner skin, right? Of course, inner layer. I could also ask this, since we know smooth muscle and elastic, I could ask the middle layer, does it contain smooth muscle, cardiac muscle, or skeletal muscle? And we know, can I control my lymphatic vessels? No. Does my lymphatic vessel have anything to do with my heart? No. So it's got to be what? Smooth muscle. And of course, it has to have elastic fibers because I'm taking extra fluid, so I have to be able to expand. So those of you players at home and players here in our live studio audience, you could see how that's how you take apart my lecture or any other lectures and then do what? And if you know it's a multiple choice examination coming your way, you just figure out every permutation and every way. Question? Yeah, we're gonna get to it. Kind of like in a row, and also hint, I'm actually looking at the actual questions on the exam, but I'm giving you topics, right? Not the question answers, so that you know what to study, especially if you don't know, if you don't know what we just talked about. So if you don't know this, then what do you need to do? Study that part. Now, remember we just talked about like what is lymph fluid anyway. We already talked about that. What does it have? It has white blood cells because it has, of course, an immune function. It has everything that plasma has.
Like water,
CO2. Protein, and everything, but no plasma proteins. Let me repeat that. Lymph fluid has everything plasma has, but no plasma protein. So if I ask you, does lymph fluid have fibrinogen? You'll say no. Does lymph fluid have albumin? You'll say no. Does lymph fluid have did I say fibrinogen already?
Yeah.
Yeah. Immunoglobulins? No. It has what as its immune function? White blood cells. End of list. But does it have all these other things like oxygen, carbon dioxide? It has fluid, of course. Don't you think some electrolyte hormones are in there? Sure. But no plasma proteins. So doesn't that look like, what does lymphatic fluid have except question? Hint, hint, right? Or what does it do have? So I could ask you. It goes, does it have oxygen? Yeah, sure it does. Does it have carbon dioxide? Yeah, sure it does. Does it have electrolytes like sodium, calcium, potassium, magnesium? Yeah, floating all out in there. But does it have any plasma proteins? And we're going to put that right there. No, not. Hey, how's this? Let's put it in red. No. No. Plasma proteins. So no one's going to get fooled by that. Right? And that makes sense because what's in the plasma proteins? Do grab somebody's what do you call that? Grab up somebody's lymph vessel. No, the only thing I stick a needle. What? Well, for our training and for our purposes, is a vein, and vein has plasma in it, so you could look at it that way, like backwards. Okay. Next.
Can you go over that one more time? I'm still a little stuck right there.
So we all know the chart of what's in plasma protein, right? I mean, what's in plasma, the liquid portion of blood. We also know that in the liquid portion of blood, there's a whole bunch of proteins. But in lymphatic tissue and lymphatic vessels and in lymph fluid, there is no plasma proteins. So just keep that in your head. No plasma proteins in lymph fluid, right? But it has what? Everything else. So the next one is layers. We already went over. Now, we already also went over what is edema. And of course, edema is an abnormal condition. It means what? Excess of fluid. So it has nothing to do with blockage. It has nothing to do with hyper or hypotension. It has nothing to do with, chemotax, any of these terms. All edema is what? I just have excess fluid. And we know from hemostasis and homeostasis, too much fluid is just as bad as what? No fluid. So dehydration is the other opposite, and it goes, too much fluid is what? Edema. And that's never a good thing. Now, the lymph vessels also act like veins. So what does a lymph vessel have to prevent backflow?
Valves.
Valves.
Yeah.
So what does a vein to prevent backflow? Because remember, what does a valve do? If you see how the valve is, it only forces the fluid to go what? One way. Do we want any of the fluid to back up? If the fluid backs up, then what do we have? We have edema and lymph vessels. And if the fluid backs up in veins, we have varicosities or varicose veins. So just know that, hey, doesn't that look like a beautiful both A and B question? What vessels in our body or tubes in our body have valves to prevent backflow? A, lymphatic vessels, B, vein, both, neither. Of course, it's what? Both. And then now you know how exactly our blood vessels prevent backflow, and they prevent it via valves. That's the worst I could do to you.
So you said what? Can you repeat the question more?
Yeah, like this is not on the exam, this question, but this is a nice example when you see some things that are similar and they match up, right? You can put them together. So I could ask a question, or a question could be asked is, which of the following vessels have valves, right? Is it A, lymphatic vessel, B, vein, C, both, D, neither? And you guys now know, because of these notes, it's what? Both. I could ask also, is there a system where backflow is prevented in the lymphatic vessel? A, vein, B, C, both, D, neither. And of course what? They both prevent backflow, because we know that if we have backflow, we know that blood, lymphatic fluid goes what? In a cycle. And a cycle only goes what direction? One direction. When things start backing up, that's not a good thing, is it? Right? And remember when we drew the cardiac cycle, right? When you look at the cardiac cycle, it only goes what? One way. For example, blood doesn't go from the left ventricle to the left atrium. It always goes from where? From top to bottom. If it starts going up the other way, how much trouble are we in? You're in a lot of trouble, because is blood then, or lymphatic tissue or lymph fluid, if it's not going in one direction, is it going to get to where it needs to go? No. And if it doesn't, that's when you get edema. And for veins, if it goes in the wrong direction and gets backed up, and the valves don't work, and that's when you get varicose veins, right? So you could see again, once again, knowing your anatomy and physiology, it makes pathology what? Almost stupid. Like, oh, that's exactly how bad things happen.
There you go.
So another one, we also, of course, talk about our spleen. Now, what's important about the spleen? There were two functions, right? Question.
Yes, okay. Arteries and veins.
Yeah, we'll get to that because that's in chapter 14. We want to stay like one chapter at a time so that, because if we start like jumping around, because if you notice my quizzes and my exams, they're in order, right? So we're going to get to 14 right after this, like arteries versus veins versus capillaries. But right now, because in chapter 16, our spleen, what does it do? What's the one thing that our spleen does that we already know? So stores emergency blood. Okay, that's nice to know. But we're more we more want to know about its immune function. So doesn't the spleen, the white pulp, doesn't it, what do you call it, recycle white blood cells?
Yes.
Yeah. And that makes sense because white pulp, white blood cells. And that's what the spleen does. Breaks them apart, old. And another thing that the spleen does, of course, red pulp, that recycles red blood cells. Let me put you here. So those are the things that we know about the spleen. So could there be a question of which of the following is a function of the spleen? Does it store emergency blood? Yes. Does it recycle white blood cells? Yes. Does it recycle red blood cells? Yes. So the answer is D, all of the above. Or we could ask it backwards. Which of the following organs stores emergency blood? Kidney, liver, lung? I could do it that way, right? Which of the following recycle white blood cells? Is it white pulp, red pulp, orange pulp, right? And there's only what? White and red. So don't start playing games with yourself. White pulp, think what? Spleen. Recycle white blood cells. Red pulp, recycle red blood cells. Because remember, red blood cells only has what? Apoptosis or shelf life at about 120 days or so. So when the red blood cell gets a little bit ragged, it runs through the spleen, and what does the spleen do? It breaks it up, recycles whatever it has to recycle, and don't you think the spleen don't you think now if the spleen takes away any of the red blood cells, don't you think it's a signal to make more? And we're going to talk more about that in chapter 14. But right now, spleen stores emergency blood, white pulp, white blood cell, red pulp, red blood cell. Okay, that's that. Next one is, okay, let's talk about B cells and T cells. Because you know that's going to come out. That has to come out. Make a B cell side and a T cell side. So, which one is the memory cell, B or T cell? B cell. That's the memory cell. B cell is also known as humoral immunity, and the T cell is also known as cellular. That's a nice little side note. But what do the B cells make? They make, since they have memory, since they remember stuff, they make antibodies. And that's the one that looks like the Y. I'm going to put a little Y like that. Now, where are the B cells from? The B cells, we know they're bursa derivative, but for us, think what? Bone. And the T cell, think what? Thymus. We had already that question. Now, B cells make antibodies. What do the T cells make? They make two cells. They make a T helper, and that was our CD4 plus. And they make a T cytotoxic, or T killer. It's called T killer, I like that better. And that's your CD8 plus. And I won't ask you CD4 versus CD8, but it's out of habit that if I write T helper, I'm going to write CD4 right next to it. And I write T killer or T cytotoxic, I'm going to write CD8 next to it. And this is how I kind of remember it for future reference, because what's 8? 8 is what? Eat. So which one's going to eat? T killer, right? That's going to eat. But what does a T helper do? That's your antigen presenting cell. That's the only antigen presenting cell that we ever talked about. So let's look at this. Now that I split it up into two, doesn't this scream a both A and B question? Right? So it goes, which of the following are lymphocytes? B cell, T cell, both, neither. Of course, they're both what? Lymphocytes. Which of the following are A granulocytes? B cell, T cell, both, neither. Of course, both of them are A granulocytes. Which of the following A granulocytes are from bone? B cell. Which of the following are from your thymus? T cell. Which of the following are called cell? Cell. Which of the following make antibodies? B cell. And you can see, because the answers are what? In the category that I created. Which of the following have T helper? I goes, well, I'm not going to ask which one of the following has T helper, T killer, because that's already telling you it's a T cell. But I could ask you, which one will perform phagocytosis? Which one is our thug? Which one is our killer? Which one's going to eat up the bad thing? Of course, your T killer, T cytotoxic, which is your CD8, right? But who's our only antigen presenting cell that we ever talked about? There's more antigen presenting cells, by the way, but the only one we ever talked about is your T helper, CD4. And what does the CD4 does? It's the tattletailer. It's the one that's going to whistle to all of our thugs. And let's list down our thugs. T killer, natural killer, monocytes that turn into macrophages, right? So all of those that we just mentioned, do they think for themselves? No, they're brainless. They do surveillance. They run around. And what are they surveilling? They're looking around for any chemicals that can tell them do what? Kill that thing over there. That's all they do, right? They're waiting for that CD4 cell and other antigen presenting cells to grab onto the bad thing and say, kill this right now. And then, of course, we already now know, and we're not going to talk about it because I don't mention pathologies because this is anatomy and physiology. You can easily see why HIV is very serious. And it loves to eat, not eat, it loves to take over T helper cells. So this is a lovely chart that I made. And making this chart, you can easily make how many questions? Right? What? 6, 5, 6. And you know, I'm looking right at the exam. 2 of them are on it. 2 questions regarding this. B cell versus T cell is on your exam. Now, we're good with this? Can I erase it? Well, it goes, and of course, if you're not finishing copying it, I'm recording this, so God bless. I'm recording it so you can look at it again later, over and over and over again, so you can get down at least chapter 16 down pat. So what's the next thing? White pulp. Okay, here's another thing. Innate versus adaptive. Again, don't you think this is a lovely? Once you see the category innate versus adaptive, every time categories like that where it's a comparison, right? In a multiple examination, you know your professor is going to put what? Is going to make you try to compare the two. Which one? So both of them are what? Immune systems, right? Now, innate means you were what? You're born with it.
First line of defense.
Right? Adaptive means you'd have to be exposed, and then what? And then, I don't know, did something. Did work. Okay. So, examples of innate immune defense. So the first example, of course, is you're born with it, right? Next one, what else do you have? Right underneath your skin, mucus. And you see that skin and mucus, it's like generalized, and you're born with it. And the last one is inflammation. Is inflammation specific? No. It happens whenever there's mast cells, whenever there's histamine, and it's non-specific. Also, the littlest baby has inflammation. You scratch a baby, well, don't do it, right? But you scratch a baby's skin significantly, it'll puff up, it'll get red, right? So that's all innate. Let me look like categories. Now, what's adaptive? We already know that what? In order for you to have memory cells, right, and antibodies, we already talked about it in hemolytic disease of the newborn, RH. You have to be sensitized. You have to be exposed. So once you have sensitization, what are you going to make? You're going to make antibodies. So when you get antibodies, is that the first time you've ever been exposed to something? No, that's the second time. Just like hemolytic disease in a newborn, just like RH factor. Mommy had to have been exposed to it by the first baby. So first baby doesn't get hit, it's the second baby. So adaptive is what? Think if you see antibodies, if you see me mention sensitization, right? If you see me mention B cells, then you know what? That's adaptive. That's what? Second. So innate, first line of defense, skin, mucus, inflammation.
So adaptive second.
Yeah. So adaptive means what? You had to have what? Seen, and what's third line? Is antibody. First line is, of course, skin, mucus, and inflammation.
The B cells.
Yes, B cells, because who makes antibodies? B cells. So it goes, if the B cells get activated, that means what? You got exposed to something, and now your humoral immunity, your B cells are now doing work. And they're doing work to make what? Antibodies. It's adaptive.
So are the T cells innate or don't worry about it?
No, the T cells are, of course, also adaptive. Because remember, right? The T cells have to do what? Get exposed, right? They got to see something. And yes, you're born with T cells, but the second you are born, it's not guaranteed that you have enough of them. And it's only T cells and B cells only get activated through exposure. Now another thing, they talk about skin and mucus. They call those mechanical barriers. So I'm going to color this in green or yellow. And the ones I'm coloring in yellow, they call those mechanical barriers. Because can you get through skin when it's intact? Nope. Can you get through mucus when it's intact? Nope. And you guys remember why I don't like surgery. Because what are you doing when you do surgery? I am opening up your mucosa, I am opening up your skin, I'm opening up your endothelial lining to the rest of the world, and that is a potential danger.
But you're eventually gonna get it on your knees, right?
Yeah, no, not if I can help it. Let's see. Now, let's see what the other two doctors say. Question.
Would that be like could you make that a question? Like,
Yeah,
what are the?
I could ask, which of the following,
Okay.
skin, mucus, inflammation, antibodies, which of the following are a mechanical barrier? And you could tell me, of course, skin and mucus. Or I could say, I go, mechanical barriers, are they innate or are they adaptive? And you know here, the two mechanical barriers are what? Skin and mucus. And they're innate. I'm born with it. So if you're, skin and abnormal mucus production, they're gonna have some trouble. Remember there was a slide. So are we good with this? I'll pause for effect so that you can pause on the video.
What are they called one more time?
Skin and mucus?
Yeah.
Mechanical barriers.
Thank you.
Let me write, at least around, well, let me write it down here. Well, for our players at home.
Oh, right.
And also for the video. So mechanical barrier, think innate. Mechanical barrier, think skin and mucosa. Sitting at home. All right. Another slide that you guys saw was, it was like a straight up, it's a straight up, it was like this. It had like phagocytosis. Oh, what's my underline? It had like phagocytosis. Interferons. Do you guys remember that? Benson, complement, and that nature. So let's define these, because don't you think I could all jumble them all around and then either present a definition, just like medical terms, or I could use some, and then you need to tell me the definition. So for example, so that's what our thugs do, right? Monocytes, macrophages, cells, and T killers. They perform phagocytosis. Ooh, that's not on, but that would be a nice question. But that's not on. But what's on? I could means that these cells, my thugs, phagocytosis. Now, chemotaxis. Chemo means chemical. And what does a taxi do? Taxi brings me somewhere, right? So chemotaxis is the ability for the white blood cell to migrate towards trouble or towards a pathogen. Why am I trouble? Pathogen, of course. And of course, pathogen means something that, let's say, something bad is over there. Cancer. We talked about cancer and necrotic cells. They have a jacket that says what? I'm cancer, right? On their jacket, don't you think they're going to release some chemicals? A little bit of a smell, chemical smell. Tumor necrosis factor. It means what? Hey, there's something here. I don't like it. So the white blood cell is going to chemically sniff it out and then start moving towards the pathogen. And that is called chemotaxis. So think chemo, chemical, taxi, right? It's going to transfer the white blood cell where? To where it needs to go. It's going to taxi the white blood cell to the pathogen. Now, this interferons, defensins, complement, immunoglobulins, can I put them all together? Yep, and that's what I'm going to do right now. And the other one was immunoglobulin.
Isn't like the immunoglobulin, like I had a question, which of the following plasma proteins deal with chemotaxis?
Taxis we just talked about, and I'm going to highlight it. That the white blood cell is sniffing out. And that's interferons, defensins, complement, interleukins, immunoglobulins. Some of them are chemicals, some of them are proteins. They're all in your plasma. And that's actually, when we measure your plasma, we kind of know, is the chemical messenger system of your immune system intact? That's actually how we know that antibodies are being made and your immune system is doing its job. So you don't that, oh, interferon, defensin, complement, interleukin, immunoglobulin. All of them is a generalized, because generalized for this exam, the chemicals that the white blood cell gets attracted to and uses as a messenger, so that oh my God, so that the thugs can do their job.
So is that like technically the name of the taxi to say?
Yeah, no, that's the name of like the whistle. You know when you got a whistleblower, like you know, interferon. right? If the white blood cell sees it, it's hit. So I got to go there, and I got to go deal with the neighborhood. Same thing with defensins. Same thing with complement. That's why they call it complement, because if I have an antigen presenting cell, it's complement to the antigen presenting cell. Like the antigen presenting cell release a certain amount of complement. Yeah, that's the chemical smell that they're sniffing. Immunoglobulins, interleukins.
You said chemicals that white blood cells are attracted
to.
That's it.
Right? And he goes, because remember, the thugs don't think for themselves.
Okay.
Right? They need somebody to tell them where to go, what to do. And who are these somebodies? These chemicals, interferon, defensin, complement, interleukin, immunoglobulins. And you'll learn in future training that they all, just like the white blood cell differential, they all have specific things. Like an example, IgE is specifically for allergies. So I see an increase in IgE in my patient's plasma, I know what? Their allergy is kicking up. Or if they're asthmatic, I see IgE kicking up, that means what? They're gonna have a rough time. I'm gonna I don't think I asked anything specific. There you go. All right. So, another set of terms that also came out on the slides were the following. Endogenous pyrogen and agglutination, anaphylaxis. If we talk about agglutination, we got to talk about antibody, and we're going to talk about it again in chapter 14. So let's look at these terms because they randomly came about. Now, when you see the word endogenous, that means what? Inside or outside? Inside. Gen means what? Creation of. So, using our medical terminology powers, something on the inside is creating what? And pyro. If someone's a pyromaniac, what do they like doing? Starting fires. So, pyrogen is your temperature, fever. So, when you see an endogenous pyrogen, right, think what? Fever.
You're saying these because they might be on the exam?
Yeah, I wouldn't be talking about it if they weren't. That's what the function of the Thursdays are for exam days. I cut through all the unnecessary fat to get right to the meat, which is endogenous pyrogen. Think what? Fever, because it's coming from where? Inside. Pyro means what? Fire, right? And fire, fever. So remember what you need to know about fever is that its main function is to make the environment bad for viruses, bacteria, fungus, or whatever that's trying to grow in our body, right? Whatever quote unquote bad thing is trying to grow in our body. But remember, just like anything else, too much fever, don't you think that's a problem, right? But for our purposes, for the exam, just know that you see endogenous pyrogen, pyro, think fire, think fever, right? That's the only thing you need to know. Now, agglutination, I want you to think what? That's the clumping. And what happens in the clumping? Antibody plus antigen. Because you know, and now let's talk about antigen versus antibody. You know that the antigen is the what? The coat, the jacket that starts the trouble, right? The antigen comes strolling into my neighborhood wearing the wrong jacket. So antigen is the protein, glycoprotein coat on the on whatever cell, like the bacteria, the virus, or whatever, that what? Generates or starts the trouble. And what's the trouble? In a fight, it's going to be what? Clumping, right? Fights aren't pretty. They all get clumped all together. Now, who's the antibody? Right? And that's the one that's labeled, you know, anti-whatever. And the antibody is the you know, the Y-shaped protein that we drew. That's the thing that the B cells make to do what? Finish the trouble, right? Because you know there's always two to tango, right? In a fight. Well, this is an immune fight. So you got one that starts the trouble, and then of course the antibody, the Y-shaped protein, is going to finish it. So they're going to do what? Fight, right? And when they fight, they got clumping, then that's antibody and antigen reaction, and that reaction is called agglutination, which you saw in laboratory yesterday when we looked at the blood, right? It was all like what? It was all, you know, clumped, for lack of a better term. So if you see the word clumping, if you see antibody antigen reaction, you know that there's an immune process going on, and that's called agglutination. And we're going to talk about that again when we talk about our lab midterm, when we talk about blood typing and how to actually visually see and know what the blood type of our patient is. Now, anaphylaxis. Ana means parts, phil means like protection of, but for us, it's not protection, it's bad news. Anaphylaxis is an extreme emergency. I'm going to write what? ER or ED. That's an extreme emergency situation of an exaggerated immune response. And it's dangerous. Because remember, we talked about heparin and histamine. They're good if it's locally, right? But what if heparin and histamine got released where? Everywhere. Don't you think everything's going to start to close up? Don't you think everything's going to be at edematous? And anyone here ever had anaphylaxis or a really bad allergic reaction, right? Like a really bad allergic reaction where you couldn't breathe? No? You did? You can't breathe, right? What happened? All this got what? Closed up. Everything starts puffing up. Then you can't breathe. And that's what anaphylaxis is. It's a very extreme emergency room, exaggerated immune response. So if I, on the exam, talk about patient got rushed to the hospital, we can't even put a tube in, everything got closed up, massive amounts of histamine, massive amounts of heparin, then you're thinking what? Anaphylaxis. Question?
So with that one, how do they break out in the rash?
Well, the rash is when you go into anaphylactic shock, the last thing, you know, you get all red and stuff, because remember, what's inflammation, right? Your blood's going to go where? Everywhere, because the heparin is going to, and oh, that's a nice side question for chapter 14. What will heparin do to your blood? Make it thinner or thicker? Thinner. So it's thinner. Now where's the blood? Everywhere. So my patient whose throat is closing up, what's going to happen to her face? It's going to not only puff up, it's going to get what? Bright red. What's going to happen to everything? She's going to get warm. How's she going to feel? Is it going to tickle or is it going to hurt? It's going to hurt a lot, right? And of course, you have functiolacea. What's going to happen to you systemically? All your ana, all your parts, they will stop functioning. Your heart, your lungs, everything. So that's why anaphylaxis is very scary, right? And but it's an easy fix. You do what 4 or 5 cc's, 1/1000 epinephrine, right? The EpiPen.
Do you put
Boom.
cream on it or oil?
No, because it's what? It's systemic. It's inside. It's everywhere. And this person is in a lot of trouble. Cream and the skin is the last thing I'm thinking of. The number one thing I'm thinking of is their lungs and their heart. It's filling up with water and it's shutting down. And then because they can't breathe. And all of this is filling up with water. So even if this was open, let's say for the last patient that I tubed who had anaphylaxis, do you think she could still breathe? No. I got airway, but nothing's going in because what's happening? The massive amounts of edema. Your question and then Ms. Crohn's question.
Anaphylaxis, think heparin only or heparin?
No. For the exam,
Okay,
I just said it because my clinical, but we already know inflammation requires what? Heparin and histamine.
Okay.
So what if my inflammation got crazy like an anaphylaxis? So what's going to happen? You're going to have massive amounts of histamine running through your body, massive amounts of heparin, and you guys know that's not a good thing to have.
Yeah.
Right? We all need to be in the middle. Ms. Crohn, your question.
So anaphylaxis, it doesn't, I understand what it means, but it can
Go away.
No. What I'm trying to say is it's not just about like having a allergic reaction. Can it
No,
also
it's an
be like
extreme allergic reaction, meaning, and it's systemic. It's everything, your left toe all the way up to your brain.
But it's just allergic reactions. It can't be like, because you said like your lungs like get, you know.
Because what's
with
an,
water. Can it be like the
what's an
first round?
allergic reaction? Agglutination, right? Your body will start fighting what? Everything. And in anaphylaxis, it's not autoimmune, but your body's just doing what? It's trying to protect itself. But the problem is, when you overprotect yourself, what happens? You put yourself in a very, very dangerous position. Because your body wants to close up because it didn't like whatever it got exposed to. So for example, I got anaphylactic, I went into anaphylaxis because I'm allergic to shellfish. But I got free food, so I wasn't thinking, right? So we went to a seafood joint. One of the other doctors treated me to seafood, and I did what? Because it's free, right? Then what happens? The nurse next to me goes, "Oh my God, your left eye just closed." And I'm like, huh? And then my tongue starts swelling. So am I talking real well? I'm like, what are you talking about? You know, it's just a mild reaction. Who's the doctor here? Me or you? And then I was, and then I started wheezing. Next thing I know, the nurse is now what? Talking to the waiter because they need an EpiPen. Next thing I know, right? I'm buck naked in my own ER, right? Because why? Everything did what? Shut down. Oh, I blacked out a couple of times on my way to the ER. Because why? This got closed, this got closed. So I learned my lesson. Every time I got to go eat some crab cakes, I better bring some Benadryl with me and my EpiPen. Because if not, that'll happen again, right?
So it's just related to allergic reactions. It can't be like your lungs got filled up with something. Like if you're
No,
like,
because that's
okay.
what? That's
That's what I
pulmonary
was
edema, and there's 18 million things that could do that. But anaphylaxis, only one thing can do that, an
Okay.
exaggerated immune response. So, and now, I remember when I was a kid, no one was allergic to peanut butter. But now kids like, they blow up, everything closes up on kids. And I'm like, what the heck? I go, I remember Isabella when she was in kindergarten. I stopped the ambulance from going because we already gave her epinephrine. But she looked like, I don't know, like this. Everything was all bloated. She's like, "Hey, Papa." And I'm like, "Oh my God." And then I go, "Who gave you a Snickers bar?" He goes, "Yeah, my friend." And I'm like, "What are you, stupid?" But then again, you know, and saying "what are you, stupid" to a 5-year-old is never a good parenting move. But you know me, I'm a CPS poster child, so everyone got anaphylaxis. Think what? Emergency, danger, danger. It's not normal. Agglutination is normal, right? This is extreme, abnormal, not good. I'll even put it in red because it is extreme. Underline extreme. So now that we got all these things down, no one's gonna miss any of these terms. Yes?
Yeah.
Okay. Next. Agglutination antibody. B cells. I don't have anything else. That's it. That's all the chapter 16. So let's take a 30-second pause, and that's it. And if you went back in that video, you'll see that I went through what? 9 or 10 topics, and I told you I got 10 questions off of those 10 topics. Question?
Can you go over the veins and the arteries? Because those were the questions.
Yeah, then now we're on what? 14. So let's talk about,
Yes.
no, we started with 16 because that was the request from the audience
Okay, cool.
playing here in our live studio audience here in here in an undisclosed location in a warehouse somewhere in Fairfax. Now let's talk about arteries versus veins, because you know this is going to come out. So let's talk about thick versus thin. Now, of course, who's the thickest out of all these three? Arteries. And of course, veins somewhere in the middle. And who's the thinnest? Capillaries. And why? Because what do arteries have? They have the tunica media, which has a lot of muscle, right? And the capillaries have to be thin because that's the area of gas exchange. And which gases, do you ask? What are the two gases we all care about? Oxygen and carbon dioxide. So let's say I could have a question right off the bat. Which has the most smooth muscle? Arteries. Because can I control my arteries? Can I say to my arteries, blood pressure, down? I can't do that, right? So, and we already know that from our sympathetic and parasympathetic nervous systems that I can't do anything about my blood pressure, right?
You just know that all three of them are smooth muscle?
Yeah, they all have smooth muscle to an extent, but capillaries don't have any because they've got to be the thinnest. They have, and in many places in your body, your capillaries are only one cell thick.
So no muscle in capillaries?
No, because what was the one that I'm always going to ask about muscle? Arteries. So if it's thick and it has muscle, then the arteries is the only one that has what? A pulse, right? All the other ones, I don't feel any pulse. Now, what about veins? Veins have what? Valves to prevent backflow. We already know that. So right off the bat, you could see how this this chart is forming and how you could form a multitude of questions. What else about arteries do you know? Arteries typically move what? Away from the heart. Veins what? Towards. And the capillaries are what? Somewhere in the middle, right? Because they have to be in the area of gas exchange. So I could ask you, who is oxygenated or has mostly O2? That's what? Arteries. Who has mostly CO2? Veins. And gas exchange, who has both? Capillaries. So right off the bat, you can easily see questions develop. Arteries, and then the choices will be what? A, arteries, B, veins, C, capillaries. Which one is the thickest? Arteries. Which one has the most muscle in its tunica media? Arteries. Because what kind of muscle? Smooth muscle. Which is the thinnest out of all the three vessels? Capillaries. In the capillaries, why are they thin? They have to be thin because of gas exchange. Which one do we use to measure pulses? Right? Not my carotid vein, my carotid artery. Which one has valves to prevent backflow? Veins. Which ones tend to take blood away from the heart? Right? And are oxygenated? Arteries. Which one are deoxygenated and going to take blood back to the heart? Right? Veins. And what kind of gas are in capillaries? Both. Another thing that I could also ask is arteries, veins. What's another question I could ask? What could we also add to this chart? Pulse, valves, away, towards. Which one's thick? Oh, how's this? Which one's under high pressure? Which one's under low pressure?
That's what I was about to ask.
Right? Of course, because if we know this is thick, the arteries, and let's make these look like categories. Here's my underline.
I'm just apologizing now for my crunching. I'm so sorry.
I don't hear it, and if I did, I'd still be jealous. Crunchiness. I'd still be jealous because I probably think it's Doritos.
I was like, what the hell are you eating?
Munch. All right.
He's like,
Yes, sir.
cucumber.
Question.
Just going back to what you were talking about in lab the other day,
Mhm.
aorta, that's the largest artery.
So your aorta is the largest artery. So is it thick? We saw it in anatomy. Yes, it is. He goes, is it taking blood away from the heart? Yup. Left ventricle, out where? To the systemic circulation. What's it full of? If you saw it in textbook, it's colored what? Red. So it's full of, the red blood cell is carrying oxygen. And what kind of pressure it is under? High. Because remember we told the story? If I nick that thing, especially the thoracic or the descending aorta, I nick that thing or it gets a little tiny little cut, what's it going to do? It's going to open up.
Yeah.
Right? And hence, that's why you always practice shooting somebody what? Center mass. Not because you're going to hit their heart, because that shockwave is going to rip that aorta and it's going to rip it enough to make the guy go or gal go bye-bye. Thinness. So I'm going to leave this chart up for the next couple of seconds. So if you're watching the video, pause it and then ask yourself, goes, how can these questions come out? And let's do this so we look cool. Mhm. And of course, capillaries, both. See? And how did we do this? We took everything that we know from the lecture and then did what? And that's the real way of studying. Just copying and recopying textbooks or recopying slides. That will just add to your work. And of course, we're a 5-week program. It's fast. So this is another skill set that hopefully you guys can go develop over time, where you can make your own summaries, and you could do it what? Actually, the best way to do it is during the lecture live. So if you start seeing your professor start making comparisons, what can you do? Like, oh, we started talking about arteries, veins, and capillaries. So on a side piece of paper, I'm gonna make a thing: arteries versus capillaries versus veins. And every time he talks about capillaries, I'm gonna write in the capillary section. Every time he talks about arteries, I'm gonna write in the artery section. And then you have notes that look like this. And it combines, if you take a look at your PowerPoint, it combines several, what do you call that? Several slides. And that's kind of like why I like your textbook, because every couple of sections or so, I think in your textbook it has something like this as well. And if it doesn't, can you Google it? Someone out there studied this before you and did what? The same exact thing that we're doing right now. So we're all good with that? Yep, it's apples, the oranges, and that's what we're always doing. When you think about it, all the questions, a lot of it is comparison. Like, do you know left from right? Do you know up from down? We already mentioned, now how about red blood cell? White blood cell? Platelet. We already went through this before, but let's go over it one more time, just for laughs. You guys actually did pretty well on it.
Thanks.
Overall, but let's just to make sure. Now, what are red blood cells called in medical terminology, Rand? Erythrocyte. What are white blood cells called? Leukocytes. Platelets are called thrombocytes. So we use our medical terminology. Could I ask it that way? Sure. Just to keep you on your toes. Now, of course, function. What do red blood cells do? They carry. What do white blood cells do? They fight. And what do platelets do? They clot. Right? What do they look like? Right? Red blood cells look like what? Biconcave disc. What do white blood cells look like? And of course, that's your differential, your diff. Right? They all look different, right? But they're usually like what? Purple. And they're usually bigger than your red blood cell. If you remember the anatomage histology slides that we went over yesterday. And then what do platelets look like? They're really small.
Tiny.
They're tiny. They're scraps. They're not even whole cells. They're like pieces of cells. That's all that the platelet is. But the thing about our platelets is they're extremely sticky. Now, what else? Fibrin and fibrinogen associated with platelets because it's associated with clotting. So I could put that in that category.
Are fibrin and fibrinogen the same thing, or?
No, because remember, when we look at the word fibrinogen, remember hormones? There are hormones that kick other hormones. Like one thing has to activate another thing. Well, fibrinogen, right, when we see damage, right, the fibrinogen gets released. Fibrinogen then tells fibrin, hey, make more fibers. And then the very presence of fibrinogen tells the platelet, hey, go over there and make things sticky. So now you got a whole bunch of fibers, then you have sticky, then you have what? Frying pan farm. And then it'll do what? Go to the door. It'll make it sticky, and then you saw that picture, that micrograph picture in your textbook and on the lecture. Then if the door is sticky, let's say that door is damaged, will the red blood cells and white blood cells be able to go outside? No, and that's hemostasis. That keeps me having 5 liters in the morning, and what happens when I go to sleep? I got still 5 liters at the end of the day. So we look at this, that answers your question, red blood cell, white blood cell, platelet. And I did it, and we can ask what? A whole bunch of questions. I can ask a function. Now, I wrote diff here. So we're gonna have to do what? Let's do the differential. Now the differential has what? What are the 2 types of white blood cells that we know? Granulocytes and agranulocytes. So let's now go to granulocytes.
I'm sorry,
Agranulocyte. Now, of course, granulocyte has what? Granules. And who are the only 3 that we know? We only know what?
Basophil,
neutrophil,
neutral, and then
eosinophil.
It's not really what's called, yeah.
Of course, what do you fill a pothole with? You fill it with a granule. So you know those 3 are what? In that group. And the other group is the other group. So if I ask you, what's a granulocyte? You'll tell me what? Fill, fill, fill. I'm filling my pothole with granules. So we all got that down. So now let's look at, now for the lab, you're gonna have to be able to tell me what each one looks like. And I'm gonna have, probably by tonight or this afternoon, I'm going to have my lab reviewer with pictures. What are all the pictures you're gonna need to know for your laboratory midterm? And I'm gonna do that after every lab so that everyone will be on the same page where the pictures are. But since this is the exam, we're gonna deal more with what? Function. So, which of these 3 get increased in our white blood cell differential when there's a bacterial infection? Bacteria under neutrophil. Which one of these 3 gets elevated in a parasitic or allergic reaction? So I'm going to write parasite and allergy. And last but not least, he goes, who is elevated when there's increased histamine, increased heparin, and overall massive inflammation? That's, of course, whoever's left is basophil. So, right off the bat, does this look like a must-know question? Don't you think this is going to come out? And it's going to come out because why? You saw it in lab, you saw it in lecture, and isn't it super clinically relevant? Yes, a nurse needs to know what the diff is, right? And that's your white blood cell differential, that's your granulocytes. Question?
There's not an exclamation point on the eosinophil one.
I don't know.
Okay.
Because parasites are, we could put one, but
You just mentioned
I don't know why I put me, I don't see eosinophils that much. Neutrophils I see all day, every day.
Really? You don't see eosinophils often?
No. Because if my patient's immunocompromised and have an allergy, it won't show up anyway. But that's for future lab stuff that you guys don't need to know.
Really?
That's my job. So what's the only thing left we got for agranulocyte? Lymphocytes and monocytes. And we already know monocyte hulks out and makes what? So I want you to put monocyte and macrophage together in your mind because they're essentially the same thing. And they are agranulocytes. Now let's talk about lymphocyte because then you could see now my lymphocytes are going to break down into what? B cell, T cell. And do we have to go over that again? Nope. Because now you know. I could ask. Because which of the following is the agranulocyte that that has that acts as an antigen presenting cell? And you'll tell me T cell. Which is the agranulocyte that makes antibodies? B cell. Which is what is the precursor to macrophage in the which agranulocyte is the precursor of a macrophage? And you'll tell me what? Monocyte. He goes, what is the monocyte? Which agranulocyte transforms into a macrophage? Monocyte. Now, you can see that when it's in a diagram, it's clear. But on the exam, I'm going to say, which agranulocyte? Is it monocyte, neutrophil, basophil? So you have to know that what? Phil is what? It's not an agranulocyte. Therefore, it is not an answer. But then, if you already have this chart in your mind, you already know he can't trick me. I separated it already. There's no way he can trick me because, well, I'm not tricking you actually. I'm just asking you straight up. But because now you can't even trick yourself because this whole thing is now what? Now it's in a visual representation and it's in categories. So come exam time, all you have to do is close your eyes. Look at the categories. And they're there. Or draw a picture. Neutrophil, maybe draw like a big bacteria. And a basophil, maybe draw it in bubble letters to do inflammation. And eosinophil, maybe make it a worm. I don't know, because parasites are what? Well, what's that classic parasite? Are worms, usually in kids.
Or you can E for ooh.
Yeah, ew, allergy, yuck.
Wait, so is this chapter 14?
Yeah, it's all 14, because 14 is what? Blood.
We're jumping around, so.
No, we're not jumping around. We started 16, and then I said stop. And then I said, we're doing 14. So are we jumping around?
It's just not in order. It's fine.
It's in order. 16, then 14, then 15. What the fuck are you talking about?
Yeah, you're right. You're your doctor.
Are you okay? It is in order. Why would I jump around?
We appreciate it.
Why would I jump around to confuse the heck out of you? Why would I even do this? To confuse you? And if you're confused coming from 16 to 14, this ain't the job for you.
Okay.
All right? By the way, these little pity little comments piss me off. How's that? Right? If it doesn't detail to your order, oh, you're gonna have a fun time in the ward trying to tell that to your supervisor. Go tell your supervisor, this is not in order. Oh, you're gonna put order in you. And I'm gonna be there to watch. Right?
I apologize.
And I'm not gonna say nothing. I'm gonna go, let's just curse up and curse. Hope you don't get charged. Guys, like all these little things, all these little stuff, I try to ignore as much as I can because you guys are a good bunch, I know. But you guys, because like I mentioned yesterday that the group was with me yesterday, these little personality things, keep in check because the person in the white coat will check it for you, right? And goes, so please be careful because the people that go after this class, they are not as informative and friendly as I am, right? And I just gave you guys just a little taste of what I am really looks like. And like I always say, oh, this is hard. No, it isn't. This is the most simplistic, the most organized way to look at it. But if you do not feel that it is organized or simplistic, then again, I have to say, reevaluate your skill sets and reevaluate your goals for this particular program. Because I am toning this down immensely. All right? So is there any other way you can look at this? Right? Can I mix up granulocytes and agranulocytes? Yep, but is there any way that you're going to be able to mix it up if you know this chart? You can't. So if you're in an emergency situation and you got a lab and the nurse is screaming at you like what? What did the lab say? Then you can easily do what? Increase in neutrophils. It looks like a bacterial infection. He goes, I don't see any B cell and T cell lymphocytes. And he goes, what do you want me to do? That's the nurse we're looking for, right? Well, not the one who says, well, in the neutrophil category, it's red. I've had people say that to me. Eosinophil is blue, and you're like, oh, no. And that person gets replaced. Who I said that to the other day? There's a saying in Japanese culture. Here in America, we say that what? Squeaky wheel gets the grease, right? Well, in Japan, the nail that sticks out gets what? Hammered. And it's usually the latter in medicine. So just, just a word of caution, a word of advice. Now, we talked about, what's another thing? Hemoglobin. What do you need to know? Right? Protein in where? Where is it? It's in my blood, right? You know I always put hemoglobin and myoglobin together because they look what? Similar. But hemo means blood. Myo means muscle. So both of them carry. What are they carrying? Oxygen, right? Now, what is the thing that makes it sticky in that lawn chair that we talked about? That lawn chair, you know how the conformation of the hemoglobin, didn't it look like a messed up lawn chair? Like all these wires, all these like tubing, and you can kind of use your imagination. There were 4 seats, and in those 4 seats, there was a disc. It was orange or red. It's called a heme group. Heme stands for iron, Fe3+ or ferrous. So think what? Magnetic iron, that's the thing that that oxygen and carbon dioxide sit on. Now, if we talk about calcium, just in case, because we're going to be talking about a heart momentarily, calcium is what? Turn on or off? On. Sodium, turn on or off? On. Who's the only thing that we ever talked about turn off? Potassium. For this exam, think that way. Because we're now what? Game time, right? We want to keep it simple and simplistic. And then, of course, in later training and later stuff, we're going to get a little bit more complex and add on to it. Neutrophils, eosinophils, basophils, we talked about heparin. Heparin and what? Histamine. They sound the same, don't they? I could easily confuse the two. I could. Anyone could. So, what does heparin do for us? Thins blood. So if I'm thinning blood, will the blood move faster or slower? Faster. And does it make sense if there's trouble, like inflammation, don't you want the white blood cell to get there when? Yesterday. So heparin has to get released. Now, what does histamine do? Right? If I increase tissue fluid and have localized edema, what will it do to that area? Remember inflammation? I'm going to get a bump. And it's warm because blood's all around. And why do I want to gum up just that area? Let's say I got a mosquito bite. Do I want all the toxins that are in that mosquito bite to go everywhere? No. So I increase tissue fluid in that area. So when histamine is working at a normal rate, it's a good thing. But those of us who have allergies, what happens when histamine gets out of control? And it's not a good thing. You start coughing, sneezing, have a hard time breathing, right? Those of us who have hay fever and allergies. So could I ask, heparin, thins or thicks blood? Sure. Could I ask histamine, increase or decrease tissue fluid? So that's a nice quick thing. And both of them are part of, wait for it, inflammation. Now, since we're in inflammation, right, we now know this is going to deal with the 5 cardinal signs and symptoms. So I have to have a lump, some sort of tumor, lump or bump. It's going to be painful or itchy. It's going to be warm. It's also lump and warm. There's 5. No, that's for like both, for inflammation in general. There's good. All of this, histamine and heparin and inflammation is going to make some sort of lump. It's going to be painful, right? Or itchy. It's going to be warm. It's going to be red because it is blood. And what's going to happen to my function? So these things here you might see in future nursing. It's definitely on your future exams, they use these terms. But for my exam, this is just additional. But for my exam, could I ask about inflammation? And why do I need heparin and histamine in my life? Because without heparin around histamine, without my blood getting thinner, and without increased tissue fluid, I won't have these things. And these things are what? Inflammation. And then we link it to what? Inflammation is what? Is it innate or is it adaptive? Well, the inflammation, innate. You were born with this, right? I could scratch a baby. Don't scratch a baby, but if you wanted to scratch a baby, right? Do you think these things will come up on her skin? Yes, it will. But please, again, on this video, I have to reiterate and restate, do not, in any capacity, scratch the baby, because you will get inflammation, increased heparin, thins out the blood, histamine, increased tissue fluid, which will produce the 5 cardinal signs and symptoms of inflammation. And did we have to ever memorize this? No, because you just have to think bug bite. What happens in a bug bite? You're gonna get a lump or bump? Yup. Will it be itchy or painful? Yup. Will it be warm to the touch? Yup. Because will it be red in color? Yup. Will you have decreased function in that local area? Yes. And apply this also now when you're talking about inflammation to your patient. So if they ask you what pericarditis is, you can tell them, don't tell them inflammation or infection. They're gonna think what? I got cancer? Am I gonna die? Is my heart on fire? These are not stupid questions. These are questions from a person who does not have your training, and because you said the word flame, inflammation. What do you mean it's on fire? You said it was warm. It feels warm. Am I on fire? Right? To us, now it sounds what? And I can tell you why it sounds stupid, because you didn't say anything to your patient about these things. So if you had dermatitis, you have all of these things in your skin. If you had hepatitis, which by the way, you get stuck, I'd be more afraid of hepatitis than HIV. What's gonna happen to your liver? It's gonna be a lump. It's gonna be painful. It's gonna be warm to the touch, red. And one of the last things you want after your liver, there are 9 major functions of your liver, and they will all be decreased if you have hepatitis. Are we good with heparin histamine and what inflammation could do for us and what kind of questions come out? This is a beautiful alpha question right here. This we already had before last term, so it's what? A Bravo to Charlie question. This is the question right here regarding inflammation. That's the thing that I'm gonna say it. It's gonna come out. I'm looking right at my exam. It's coming out. I'm looking right at it. It's there. It's there in some form. Now, let's look at blood type, because you definitely know that's going to come out. So, pause for effect for this one. Now let's look at blood type. Now, there's 2 systems. You have ABO and you have RH. So, I want you to think of them separately, because if you start combining them, you're going to get lost. So let's only do ABO blood type first. And let's make our chart. And here's our chart. We have what? Type A, type B, type AB, type O. So could that be A, B, C, D? Hint, hint, that's what it's going to be. Now, if you look at type A, everyone's blood has to have what? An antigen in there, a coat, a jacket that starts the trouble. And in everyone's blood, you're gonna have what? Something that will finish the fight if there's a fight that goes to it. So an antigen, what antigen is going to be on a person with type A? A. What antibody? Now, antibodies are always labeled anti-something. Now, if I'm in the A gang, who do I hate?
B.
B. So if I'm type A, I hate Bs. So my antibodies, the little Ys, I'll even draw the little Y right here. That's what? Anti-B. Now, if I'm B, what shirt am I wearing? B. And who do I hate? Anti-A. Now, if I'm AB, I have what? Both shirts, don't I? And if I have both shirts, do I hate anybody?
You don't.
No. So, I don't have any antibodies. And if I'm type O, I don't have any antigens, but what antibodies I have? I have anti-A
And B.
and anti-B. So, now that I know that, who's my universal donor? Type O, and I'm going to cover in blue. Blue, O, universal donor. Donor with 2 O's. And who's my universal recipient? And I'm going to color that in, I don't know, olive drab. Type AB. They are the universal recipient. So, before we start messing with any of this, how can a question arise? I can take the first column and do what? A, B would be C, and type O would be D. And I'm not going to ask who's the universal recipient, universal donor. I already did that on the quiz. So what are the odds it'll be on this? Nil. I'll tell you that right now because it's too easy. But what kind of question could I ask? Which of the following? I still have your marker, by the way. I will keep it. I will keep it in memoriam. So A, B, C, D. Let me get rid of the colors because it's now. So this will be A, B, and this will be C. And this will be D. So if I'm looking at that, can I make 16 questions and every permutation so I could ask you, which of the following has antigen A? And you'll answer type A. Which of the following has antigen B? Type B. Which has both antigen A and B? Type AB. Which has no antigen? Type O. Which of the following has anti-B antibody? Type A. Which of the following has antibody anti-A? Type B. Which has no antibodies? Type AB. And which has both antibodies? Type O. So right off the bat, I got 8 questions. Now, I said 16. You think I could turn it upside down? Yeah. I could do it this way. My patient has type A. Which antigen do they have? That's another question. My patient has type A blood. Which antibody do they have? Right? My patient has type B blood. Which antigen do they have? So you could sit right now and figure out, or at home, and for those of you playing at home, I highly suggest you take this and you can make 16 questions. But out of the 16, I have 3. So he goes, now you have every which way. So right now, if you figure this out at home, number 1, you'll get at least 6 points, which is almost what? That's almost half a grade, right? And who's going to stop at half a grade? Nobody, right? And also, don't you think it's really important? Because one of these days, you're going to have to be able to speak to blood banking regarding blood typing. Yep. It goes, and that is, of course, our job. And you need to know this. And also, you need to know this as well, because it goes next, in 2 weeks, when we have our lab midterm, we're going to show you wells that have what? Agglutination in it. And if you don't understand what anti-B, anti-A, or antigen A, antigen B is, you won't understand. You'll just try to memorize all the wells. But again, don't do that. It's better to what? Know and understand. And remember, antigen is the coat, right? That starts the trouble. Antibody, and I drew that little Y next to it, that's that Y-shaped protein that's specific. And this is the reason why an A can't give a B, and type A can't get type B blood, because it'll fight it. Type B can't get type A blood, because it'll fight it. Type AB is the universal recipient, because why? They have both jackets. So there's nothing and they have nothing to fight back. So they're not going to have any agglutination. And type O is the universal donor, because why? They can give anything to anybody, right? Because they have no jacket to offend.
But they need O.
Yeah. So that's why we love O. Question?
So the big, I was about to say that, so for type O, right, is that somebody that has a weak immune system?
No,
Like,
no. Remember, because these are just what? The coats that are on your red blood cell, and that's your antigen, and the Y-shaped protein, right? Like the defenders, if you will, antibodies, or the B lymphocytes that's in our blood. So if you have type O, whatever type you have, it says nothing about your immune system. It just says these are the types of blood, and these are the bloods that that we can exchange properly with, right? Like that. There's some people say that, but there's some types that are rarer than others. But again, like I mentioned in class, if you live in a near a tertiary hospital, and tertiary hospital is defined as a hospital that has every department, right? And usually has a heliport, it's got everything, right? And let's say your family needs type A blood, your family member or your friend needs type A blood. If you get all your friends and family together and everyone has all different kinds of blood, you give it to the blood banking in their name, it gets to be on their account. And then they'll get more type AB blood from somewhere else. And that's how blood banking works, right? So it's like
they trade it.
yeah, we trade it. Like let's say, and that's what blood banking does. There's a database, and then like, oh, we're short AB. Oh, let me call VCU. Hey, you guys got 4 or 5 units? I need like 6. Because we don't have 4, we don't have 6, we got 3. Did you call? Goes, why don't you call DC, see if they got any? And that's what the secretary in blood banking does. And the secretary is usually medical technologist, right? So don't think immune system in that way. Like if I have type O, I have a lower immune system. Or if I'm type A, I'm most likely Asian or whatever. I'm like somebody else asked me that as well. Yes, there's predilections, but again, think only what? This chart. Question, sir.
Well, I was actually just it's actually part of what I was gonna ask is just like what influences the blood type that somebody ends up with? Is it like the region?
Pure genetics. And like I was also mentioning somebody else, this is the United States of America. Like everyone gets with everybody. So, and also, this is also the beauty of being in a very democratic populace where like you guys know and see on the media like racism this, racism that. Those of us who are from other countries, you all don't know racism. There are other countries that are killing whole races of people in the thousands. So us calling each other names is one thing, but there are places in Western Africa that are killing thousands of children just because they're Christian, or they're killing thousands of little girls just because they're Muslim and want to go to school. And it's all because of arbitrary reasons, just because humans don't like other humans, right? So that's why I bless my lucky stars I'm here and not there. Same thing with police brutality. Yeah, there's police brutality in this country, but in my country, they killed 10,000 people last year with which they're called extrajudicial killings. So we complain about what? How many people died here? 10,000 people. My neighbor was just a kid. I have a mini mart, and he was just. They claimed he was dealing drugs. He's a 14-year-old kid. Cop shot him in the head. And they said what? He was dealing drugs. He was delivering groceries for us. But is anyone going to call anybody out on it? No, because that's a not so democratic country. Who, by the way, just elected what? The son of a dictator who was a convicted murderer. So no matter what we complain about Sleepy Joe, right? He's 20 million times better than what? Most of the dictators floating around this country eating up people. Right, so that's why I love this country. It's not the best country in the world, but dang it, is much better than a whole bunch of other places that I've lived at. And oh, y'all don't want to know what police do to people in Sri Lanka. And there's a reason why the streets are clean, because they chop off your hands for littering. And I saw it, and I was like messed up. I'm like, why are they grabbing that woman? And he goes, oh, she's littering. And I go, huh? And then they brought her out to a square, and then everyone watched, and they chopped off one of her hand. And then she got to my clinic and we got to sew her up. And then everyone's looking at me like it was what, Tuesday. Me and the other people from democratic countries were like, this is an atrocity. Is there something we could do? Can we talk to the embassy? You know what everyone told us? Shut up if you won't want to get killed, right? Don't you think they'll take your passport away? And I go, excuse me? And then I learned what? I'm not in America. So I have to start acting like what? Right? Not American. And do you think a lot of people in this world love us? That's why when I go on medical missions abroad, I tell them I'm from Canada, because I always hear like, because it was around the time of President Bush, he goes, oh, you're from the land of President Bush. Oh, we hate President. And I'm like, hey man, I don't know the man personally, because I'm not Democratic or Republican. I'm just a doctor here hoping not to die, not to get malaria. By the way, I was the only physician who didn't get malaria, but I got everything else. Now, what else do you think? Do you think of what else is in the chapter? Aren't there layers?
Yes.
So can we go over each layer, and so no one well, I don't think anyone got a layer question wrong last time, but let's go over layers. All of you at home, did you like my soapbox? You can delete that from the recording. Now let's look at layers. What's the very outside of my heart? Of course, it's the pericardium. And you know, in the pericardium, there are two layers. You have the outside layer, right? And the inside layer, visceral. And in between, right, was like a layer of fluid. Now that's the pericardium, that's your outside. Now, right underneath it, you got your what? Epicardium. Then, I got my myocardium. And then, endocardium. So I don't, it goes, and if you look at the picture, you can look at it that way and memorize it that way, or use your medical terminology powers. Peri means what? Surrounding. Epi means right on top. So right on top of what? Right on top of my heart. My myocardium is the muscular layer. Endocardium all the way where? Inside.
You don't want us to know the cavity in between the iron?
Nah, because we already did cavities to death with pleura, and then we're gonna see it again. But do know and understand that all the coverings of all your major organs have both a visceral and parietal layer,
Okay.
and they have a potential space in between, and that has that serous fluid in it. But I'm looking right at my exam. I only asked what? Which layer is where? Which layer is on top? Which is inside? Which is on top? So, anyone gonna get this wrong? I don't think this is a high value topic, but if I recall my quiz, I don't think anyone got. I think only one or two people got this wrong. So, but you know what? A whole bunch of people got wrong. The valves. So let's go over the two types of valves we have. You have an AV valve, and then of course you have your semilunar valves. AV valve, I want you to think what? Who's on AV valve is the valve in between your atrium and your ventricle. We all got that, right? So the only two choices I have is my bicuspid and my tricuspid. Now, if you look at the diagram, bicuspid is on the left side, and your tricuspid is on the right. Right. And of course, bicuspid has another name because bi means two, mitral valve. But let's keep it bicuspid, tricuspid. So if I ask you, what is the valve? What is the AV valve? The only two things you're going to think of is what? Bicuspid, tricuspid. And then you're going to ask, is he asking for left or right? And left is what? Because if you recall the diagram, left is bicuspid, right is tricuspid. That's it. So we're good on that? No one's going to get that confused. We're good. Now, the semilunar valves think things that are exiting or places that it's going to go. So we know the one on the left is, of course, my aortic semilunar valve. Now, the aortic is going where? It's going from the left ventricle, and it's going out to, of course, my what? Aorta. So if I ask, what is the vessel that's oxygenated, that's on my left side, that's exiting my left ventricle? You'll tell me it's the aorta. What valve do I have to pass through to get to my aorta? And you'll tell me what? Aortic semilunar valve, right? And let's talk about the right side. That's the pulmonic or pulmonary semilunar valve. That's going to my right ventricle and going where? To my lungs. So if you look at this, even though all this will be A, B, C, D, in your mind, when you read the question, and remember our protocols when we read questions, I get only the words and the items that I need to know. So the second you see AV valve, the next thing you're looking for is what? Left or right? So if I say in between your left atrium and left ventricle, you means what? Bicuspid, left. In between my right atrium and right ventricle, he means right, tricuspid. Semilunar, I'll always say something like, what is the valve that helps me exit my left ventricle? So now I know left. Now it's ventricle. It's not atrium and ventricle, so it's got to be a semilunar valve. Going where? Going to my aorta. The aortic semilunar valve is emptying out into what? Systemic or pulmonary? Left side is what? Systemic or pulmonary? Systemic. Now, right ventricle. Aortic is emptying out where? Right? It goes into my lungs, hence the term pulmonic. Could I also ask this? What kind of blood is going through my aortic semilunar valve? Is it oxygenated or deoxygenated? Oxygenated. What kind of blood is going through my pulmonic semilunar valve? Deoxygenated. What kind of blood is going out of my tricuspid or going through my tricuspid? Oxygenated or deoxygenated? Oh, wait, think. Right side is what?
Deoxygenated.
Oxygenated. And bicuspid, left side, think oxygenated. Now, think about the diagram that I drew in the Anatomage lab that's still up there and hopefully will still be up there next Wednesday, right? Think about that. How much easier it was to answer those last 4 questions if you can close your eyes and know which one's red, which one's blue. So take a quick look at that the box video. You don't have to look at the whole thing. Just get to the end of when I drew the box and do what? Pause it. And then, how's this? Take a red crayon, take a blue crayon, scrap paper, try to draw it. This is how you do it. You try to draw it by looking at it, right? Then you rip that up. Then you turn your screen away, and then you try to draw it by yourself, but you still have the capability of looking at it. Oh, I missed a couple of things. Then you throw it away again. Then you do what? I'm totally not going to look at that screen anymore, and then I'm now going to draw it from memory. If you can draw it from memory, that means you can do what? Close your eyes and you could see it. And if you could see it, it's easily seen that what? On the right side is blue. Left side is what? Now, what other box questions could I ask? Let's see if I asked them. Nope, I didn't ask any box questions other than these valve questions. That's it. So are you going to start thinking about superior vena cava, inferior vena cava, pulmonary vein? No. What are you only going to think of? These valves. That's it. Everyone good? Now, what else? Right ventricle. Oh, no, I did. No, I didn't. Now, real quick, systolic versus diastolic. Which is the higher pressure? Systolic. I got one question on that. Which is lower pressure? Diastolic. Systolic. Is that when my heart is filling or when my heart is pumping? Pump. Systolic, think what? High pump, right? And diastolic, it's just what? It's just filling. So if my patient has a blood pressure of 120 over 80, what is their systolic? 120. 120 what? Millimeters of mercury. We just write it 120 over 80 just to be quick, but the measurement of pressure in blood is millimeters of mercury. And what is our diastolic? Of course, the bottom number. And you guys see on the exam, I kept on putting the word pulse pressure. Pulse pressure is simply the, you subtract systolic from diastolic, and normal blood pressure is what, 120/80? Pulse pressure is what? 120 minus 80 is what, 40. Pulse pressure tells me how elastic my heart is. So if it's lower or, just know that pulse pressure is not an answer, but just in case you hear it when you guys learn how to do blood pressures. Question? Oh, okay.
Can you cover ECG? Okay.
Yeah, that's coming. You guys see, you guys know me. You know me. But before we do ECG, am I gonna do this, the conduction system of the heart?
Yeah, I like to know.
Yep, it's definitely gonna come out. So who's the first one? SA node. That's called the pacemaker. It goes kind of fast. So we need somebody to put the brakes on, which is who? AV node. Brakes. Because does my heart have to go 100 beats per minute? No, it goes like what? 70, around there. So someone's got to put on the brakes so that the atrium can fill. Then who's next? Bundle of, not hers, but his, or his.
Does it matter how that's said?
No, because it's not an oral exam. But even if you said his, right? You didn't use the proper pronouns, I'm not going to kill you for it. Then, of course, you have your left and right bundle branches. Then you have the Purkinje fibers. Now, let's give an example of each one. I could ask you, what is the pacemaker of the heart? And you'll tell me? SA node. What is the brakes? What slows down the pacemaker of my heart? As AV node. Where's the SA node and AV node located? In my right atrium. Bundle of His. That's what? The next step out of the AV node. Where's that located? Isn't it located in your interatrial area around there somewhere? How about my left and right bundle branches? Right? They're located where? Interventricular septum. How about my Purkinje fibers? What the hell's going on outside?
You said bundle of his interatrial, and you said.
Yeah, I'm gonna write it right next to it.
Okay.
So think SA node, what? Right atrium. AV node, like kind of like the bottom of the right atrium. Bundle of His, interatrial area.
So we shouldn't, for the exam, we should know all.
No, for the, I'm just doing it so that if you guys remember the picture,
Yeah.
you know where it is, but it's also in the order. Now, I'm not gonna ask you location yet, not for this exam, but don't you think that was a picture that you guys did for homework? Don't you think that picture is gonna come out when? Lab. So that's why I'm putting it here just for completion. Left and right bundle branches, interventricular area. Purkinje fiber, lateral wall, ventricles. Now, you also put it there so you know the order. The order goes SA node, AV node, bundle of His, left and right bundle branches, and then what? Up and out Purkinje fiber. Can I ask you the order? Yes. Can I ask you who's the pacemaker? Yes. And who are the brakes? Yes. Those are the worst I could do to you. That's it. I'm not gonna go, where's the interatrial area? But I put the areas because to set you guys up, because if you're studying for this already, might as well study it visually at home, looking at the homework that you guys did. Yep, I'm keeping it up. God, that's a lung. So we're gonna give it a minute for the scribes. But then again, remember, like let's say you wrote it all kooky. This is on video, and I'm gonna try to look up, because that's why I like Zoom better, because I can extract the video and I can put it on YouTube. I don't know how to extract the video yet from Teams, but you know me, if there's a will, there is a way. So next, the big question that we had in the room, the Ekg waves. And they're easy, because there are only 3. So I got a P wave. That's atrial depolarization. I got the QRS complex, which is 3 waves put together, Q, R, and S, and that's ventricular depolarization. And I don't think anyone got this. Oh yeah, they did. Some people got it. Because there's some people got it backwards. T wave, ventricular repolarization. So think depolarization. Doing work. Repolarization. Polarization means what? Recharging. Because I need to recharge to what? For the next set of PQRS. Now, for this, it's going to be what? A, B, C. But for lab, of course, don't you think it's going to be a picture and it's going to be labeled? And then you have to tell me which one's the P wave, which one's the QRS, and which one's the T wave. And this is the worst I could do to you. This is it. So there's only 3 ways I could ask. Which one's atrial depolarization, P wave? Which one's ventricular depolarization, QRS complex? Which one's ventricular repolarization, T wave? So just be careful. Because repolarization looks a lot like depolarization.
Are you gonna want us to know the meanings of those terms?
Yeah, well, for now,
Okay.
you know that depolarization means doing work. That means the heart, or that part of the heart, is going to pump. It's going to contract. And repolarization just means what? I'm recharging all my sodium and calcium for what? The next thing. So what do I fill the cell with? What turns stuff off? Potassium. So think depolarization, sodium, calcium. Repolarization, think potassium. And you guys remember potassium. What do I give to somebody on death row? I give them potassium iodide. What will that do to their heart? It will say recharge forever. Don't bother depolarizing. You ain't going anywhere. They're starting to think that's still cruel and unusual punishment, but I don't know.
What?
Like I told you guys, I served 6 months with what do you call that? Forensic pathology. There's just some people, you know, they should not go out quietly, in my opinion, for the damage and the horrific, horrifying things that they've done to human beings on their way out. Very sad. We're not going to mess up medulla oblongata, yes?
Yes.
Right? That's the control center of the rhythmicity of my heart. So it's directly connected to my SA node. Arteries and veins, medulla. Oh, can we talk about erythropoietin? Erythro means what? Red. So that's red blood cell production. Now, who are the players? First of all, I need a stimulus. What's my stimulus to signal erythropoietin being released?
Low oxygen.
Low O2. Now, who releases erythropoietin?
The kidneys.
Liver and kidney. Does that look like a beautiful both A and B question? Hint, hint. Right? Who actually makes the red blood cell? Next, right? After, who tells, what's the negative feedback? Who tells this to stop? And that's the worst I could do to you regarding erythropoietin. And wasn't that picture that we showed? Question. Are you good? So I could ask you, what is the stimulus for erythropoietin being released in my bloodstream? And you'll tell me when my chemoreceptors are identifying low oxygen. Who releases? What organs release erythropoietin into my blood? Liver and your kidney. Hematopoiesis is what? The production of red blood cells. Well, it's actually the production of all blood. But for us, specifically red blood cells, where does it get produced? Red marrow, where? In my bone. Now, Who tells the system to shut off because we did enough? Increasing O2 levels, right? But you guys know, kind of in reality, it's what? Decreasing CO2 levels. But you'll learn that, we'll learn that opposite view when we do pulmonary, right? So this is the worst I could do to you regarding erythropoietin. And does what? 4 questions. And then, did you figure out all the 4 questions? Yep, right there. But I didn't write it down. You will, and you'll figure it out. Oh, the next set was another set of just medical terms.
Oh, yeah, clock.
So it's essentially medical term. So thromb means clot, and a thrombus is an abnormal clot, and it sticks to the side of the arterial wall. So it could cause trouble, but not as much trouble as what? The embolus. That's the thing that does what? Freely moves around. That's the clot that freely moves around. And if it moves around, can it get stuck somewhere? So that's why this is way more scary than what? This. Because the thrombus, we know where it is, it's there, right? It's not moving anywhere. But the embolus, singular, freely moves around, and you know that our arteries and veins get smaller and smaller and smaller as we get closer to our feet and our hands. So don't you think it might get stuck somewhere? And if it gets stuck in my heart, I'm going to have what? An infarction, which is blockage. Question?
So, for embolus and thrombus, it's like, okay, hold on. So, embolus is the thrombus moves or a part of the thrombus moves?
Either the whole part or just know that a big chunk of clot,
Yeah.
whether part or of the thrombus, just know that it's a big clot, a ball of platelets and fibrin and red blood cells are floating around.
Would that mean you have like 2 clots if that's the case?
Yeah.
Okay.
Yeah. And usually that is the case,
Okay.
because if I have an embolus, that means it broke off from somewhere. So I have another thrombus, I've got stuff going around. That's why platelets, they're good if they're what? In normal levels. If I have an abnormal level of platelets, abnormal level of fibrinogen, abnormal level of vitamin K, abnormal level of clotting factors, don't you think I'm going to start looking for thrombus and an embolus in my patient?
Yeah.
You betcha. And because I'm afraid of what? Infarction, which is blockage. And the 2 infarctions, just to be academic complete, AMI, which is an acute myocardial infarction, which is a heart attack, and CVA, which is a cerebrovascular accident, which is a stroke. So those are 2 things that I don't want. And not because of the stroke itself, not because of the heart attack itself, because of the sequelae. What's going to happen if the acute myocardial infarction is bad enough? I'll get heart failure. That's not good. If the CVA is bad enough, I'll get what? Brain damage and coma. Now, if you look at atherosclerosis, let's underline athero and let's make it yellow. Because athero, fat. So, and it's not only fat, it's fat that's kind of getting hardened. So that's a fatty plaque that gets hardened. And that's what atherosclerosis is. And what do you think that's going to do to my blood pressure? It's going to increase it drastically. What do you think that's going to do to the elasticity of my arteries? My arteries won't be elastic. And that means the blood pressure, when it gets higher and higher and higher, it's not going to go down.
Yeah.
So that's why too many Doritos in your life, too much beer in your life, you tend to get atherosclerosis. Now, a similar thing, but for our purposes, it's different because we're being specific regarding our medical terminology, is arteriostenosis. That's when the artery, the lumen or the hole, of the artery is shrinking. It's getting smaller. Because what happens when you get older? Of course, fat gets in there, damage, a thrombus, emboli, a whole bunch of garbage gets caught up in there. And then the artery, when you get older, starts to shrink. And that's called arteriostenosis. Arteriostenosis can be reversible if we do meds and we do lifestyle change. But what is that also going to do to my blood pressure? It's going to do what? Increase it. Because think about it. If the hole, and you guys know it's summertime, right? I got my hose on, right? Water's just coming out. What happens if I put my thumb on the hole? The water pressure is going to increase. And then what's going to happen? The water will go what? Further, faster. But do we want further and faster sometimes? No, not here. Because too fast will damage all my organs, especially things like my brain, like my kidneys. Actually, the first two things to go in hypertension is your liver and your kidneys. And that's the two things we pay a lot of attention to. And lo and behold, who releases erythropoietin? Liver and kidneys. I'm telling you, it's like Illuminati stuff all day, every day in anatomy, physiology. Whoever created us pretty perfect. Oh, innermost layer, la 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 la. Backflow, la 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 la. You know what? I showed you all my tricks. I don't see any other high value topics. Any other specific questions on like, this and that question on the quiz messed me up, and how do I not mess that up? And
What is the athero again? I forgot.
Hmm?
The athero, I forgot.
athero, write it down again.
No, I got it. I just forgot what that. The prefix.
Fatty plaque.
Okay.
So it's fat mixed up with some calcium, mixed up with some fibrin,
Gotcha.
some old. And what happens to that after time? It's going to get what? Hard, like a rock. And then what's going to happen? Infarction that I can't remove. And then death. No, not death, it's just disability. So everyone playing at home. Miss Collins, Miss Flores, you can kindly unmute yourself. Do you have any specific questions, comments, and or recipes? We're talking about fat.
No, I'm good.
Favorite friend. Miss Collins, you good to go?
Yeah, I just gotta rewatch it from the beginning because I missed a couple of them.
Because you were percolating? Was that you? Making some coffee? Making some Java?
No.
No? Or maybe Miss Flores. Miss Flores, you working as a barista? How you guys doing? You guys okay? If not, kindly log off, and then this video should be available here. Snapple, it's 2 hours? My, how time flies when we are having fun. So, I goes, I'll see you guys. Oh, Miss Flores, you can't hear me?
I can hear you. I can hear you now.
Oh, okay. I can't hear you, but it's okay. It's okay. The recording is there. Please rewatch the recording because it's got a whole bunch of tidbits that you would love to have for tomorrow. Everyone gets 100, yes? Perfect. Yes, I will accept no less. All of you playing at home, thanks for playing. And it was Miss Collins and Miss Flores. I'll add you to the list. Did everyone sign in the sign-in sheets? Yes. Thank you very much for playing. Don't let the door hit you on the way out.
Really appreciate it. Thanks a lot.
Happy birthday to me.
It's your birthday today?
No,
I gotta sign in.
I don't have a pen because I am unprepared.
Me too.
Is it your birthday today?
No. July.
When is your birthday?
July
July what?
18th.
July 18th?
Mhm.
Yeah, it's right there.
I will be a ripe 5'2". I will be snapperific. Oh, wait,
July 18th.
why am I recording this stuff?
July